Hello everyone. It is a pleasure to once again have an opportunity to say one or two things concerning my healing practice. I am Kemwelka Chidema Ezeke. I'm a spiritual healer as well as an alternative medicine practitioner. In my art of healing, it's a question of being gifted to be able to use herbs, food substances, and of course liquids such as fruits, juices, and even water to heal. And this gift enables me to be able to amplify the healing potencies that these healing substances do contain, to as much as being able to heal many an incurable disease. Already I have made the effort to let people know that indeed the HIV/AIDS problem can be taken care of. And over the past year since this the advert went public, a couple of individuals have expressed interest, and at least about close to 14 persons have been treated so far. Now I feel it's the time to address the issue of cancer. I have tried to do this a couple of times in the past, but for one reason or the other, usually as a result of medical intrusion, not been able to either continue with the patients who had expressed interest because they were always under the supervision of their medical doctors, and in most cases they were in the hospitals. All right, so I decided to hold a while, concentrate on HIV/AIDS, and as soon as I feel satisfied that I have done much in respect to the HIV/AIDS, that is trying to let people know that the HIV/AIDS can be taken care of, then I'll face cancer once again. And here I am with the cancer diseases. And what really happened is that my dad came down with multiple myeloma. He was in the US all the while, and so while he came down with multiple myeloma, the chemotherapy was no longer working. It was beginning to have an adverse effect on him, and he decided to go natural. And felt it was best he came back to the country and handled this thing naturally. And of course, I had to come into the picture. Whilst he was in the US, I couldn't come into the picture because that wouldn't be allowed. He was strictly under doctor supervision. But upon getting back to the country, as a matter of fact, started in the US, he told his doctors that, look, he's no longer going on chemo, that he wants to go natural. And he felt it was best he came to the country and did it naturally. And I took it up. And of course, the results are positive and most encouraging, almost in total remission. But because it's something that could come back, we are not taking it for granted. So he's still in therapy long enough to make sure it does not come back. And of course, I also put an advert on breast cancer, tropical healing remedy. That is the advert that deals with breast cancer sores. At that time when I did that, I hadn't the ingredients for the main remedies complete, which needed to be imported. And as soon as they were imported, I was able to prepare the main ingredients for all other types of cancers. And that now means that for those who do have breast cancer, or who were anticipating that the main remedy for breast cancer should be around, I want to let them know that yes, they can have that remedy. It's very much around. But there are certain things I need to say and address in respect to healing cancer. First and foremost is that there are different types of cancers, and we can group them into two types of cancers: the blood cancers and, in quotes, the tissue cancers. Okay. And the approach to healing is just as good as what you have in medical practice, in the sense that there's no heal-all approach to all types of cancers. And what it means is that what I may use for leukemia, I cannot use for lymphoma. And what I can use for lymphoma, I cannot use for myeloma. These three blood cancers are treated differently. Likewise, when it comes to tissue cancers, from the way I'm guided to heal, I have a remedy for those cancers that are well defined and are individually contained, so that is the monomorphic cancers, then I also have a remedy for those that are always in combined forms, whereby a certain other type of cell is found cancerous alongside some other type of cell altogether. It turns out that the remedy that I will use for one particular kind of doesn't necessarily work on the other cell. So combined, I have a different remedy when two types of cells are working together as cancerous cells. We call them polymorphic cancers. So that's as regards to carcinomas. Then when it comes to sarcoma, the same thing also takes place. What I use for bone tissue sarcomas is not what I use for soft tissue carcinomas. Sarcomas, sorry to say. And of course, when there are other types of tissue cancers like blastomas, of course, germ cell tumors, mesothelioma, what else that I may have to include into this group? Okay, so as it is, what I'm just trying to say is this. When you approach and say, oh, do you have a cancer remedy, please be ready with the fact that you already have undergone a diagnosis, and on the paper given to you, the type of cancer has been clearly stated. That enables me to know precisely what to look at and where to go and get you the remedy that is needed for it. Okay, people always love to ask, what are the testimonies? I would have countless numbers of testimonies by now, but one of my last cases, she had gone through a series of chemotherapies, and the breast had been taken out, but all of a sudden it came back. And she then said, you do this naturally, doctor? I said, yes, I do. So look at my situation. What can you do? And I said, okay, let's start with the cancer that has come back. So I gave her the topical remedy, and she applied it in just 2 days. She said the pains had stopped. Yeah, I'm not making exaggerations. That the swelling has gone down. All right, and that, but unfortunately, she's got these bed sores that need to be taken care of. Okay, and we were looking forward to handling the bed sores. Then I said, okay, why not just use the remedy, what you have now, just be applying it there. It's going to have a minimal effect, but her bread is better than none. And she agreed to it. Then along the line, I found that as I was thinking about her case, a vision came to me to showing me how the cancer is spreading all over her body. And I made mention of it to her. And she said, first of all, she needs to get in touch with the doctor in charge. I said, that's fine. And she came back and told me the doctor said that the cancer is in remission, that she shouldn't listen to visionaries. I told her that cancer is spreading, that my visions cannot be wrong. Okay, so she said the thing she's going to do is she's coming to Lagos and going to do a scan, and that will determine whether what I'm saying is true or not. So I said, that's fine. And she came to Lagos, and she said they said it was in remission. And then she didn't come to see me. Okay, I said I'm still maintaining what I'm telling you, that cancer is spreading. Then about 2-3 weeks later, she started fainting, having all sorts of crises, and she was rushed to one of the hospitals of the Southwest region, if I'm not correct. And it turned out that the cancer has spread through the bones, to the hips, and everywhere. Just not up to a month's time. And you know that cancer cannot just spread like that within a month's time. So it turned out that everything they had done prior to that was more or less a conspiracy. But now it can no longer hide itself. And at that point, she now believed, and of course, do you have a remedy for this? I said yes, but the problem now is that she was in hospital, and I could not take care of it. It's not just this case, there was another case exactly almost like this. Okay, it started walking, and then of course they want to go back to the hospital, and they just cut them off there. These two ladies passed on in the hospitals when they went back. So what I'm trying to say is this. I have started working on cancers, and it was working, but along the line things went wrong. I don't want to blame anybody, because I think those on the other side think they should do things this way. And for lack of evidence, proof on my part, I think they are doing the right thing. But unfortunately, if they end up wrong, because when it is proven that something is working, the right thing to do is to give it a chance to see if it really works well enough. And so, as it is, I would only want to say is, if your choice is to go natural, then you have an option. What I offer, and I believe that what it will take to put your cancer in total remission and